Hi guys, I'm Roy and I'm a chiropractor here with London Back Pain Clinic, and today I have Sean with me, who is a psychotherapist for London Back Pain Clinic, and we're just going to get to ask him some questions, try and figure out who he is, what he does for us around here. Is that all right, Sean?
Absolutely, Roy.
So before we start, just tell me a little bit about yourself.
Oh, well, I'm a BABCP accredited psychotherapist, and I've been working with the London Back Pain Clinic for the last 3 years. Essentially, I'm part of a multidisciplinary team, and where I'm providing a service for people who are struggling, I suppose, in terms of their mental health in relation to their chronic pain.
So yeah, I'm guessing chronic pain can lead into sort of mental health troubles and sort of anxiety, depression, and things like that.
Absolutely.
Is that a common thing that occurs?
Oh, absolutely. I think chronic pain can have such a major impact on people's mental health, and yeah. So I suppose, and there's a cycle where people can feel quite self-critical in relation to their pain and feel that they should be doing better, or it's their fault, and then can tend to withdraw, I suppose, and not do the things that they used to do, and that can have a big impact on their mood and anxiety in regards to integration. So I think therapy is really helpful in terms of getting people back into the system of their lives.
I guess that's true, because the more they withdraw, the less they're likely to follow with our exercise programs and sort of stick to sort of the manual side of treatment.
Yeah.
So maybe, yeah, in terms of sort of seeking out help, from a sort of mental health aspect, will sort of have benefits from both sides, I guess. So
absolutely.
So what kind of things normally happen to patients who are in pain? Can we just go through the cycle of it a little bit?
Oh yeah, as I was saying, yeah, the cycle. I mean, it's not the same with everyone. Some people adjust to their pain in different ways, but I suppose what my approach is around cognitive behavioural therapy. That's linking people's, I suppose, making people aware of that cycle in terms of the situational, and then the thoughts and the impact of their thoughts in terms of their emotions and their behaviours. So if they're feeling like they're a failure or life is over, and their thoughts, are that, they then may, like I say, have an emotion of feeling sad or anxious, and then they're more likely to maybe isolate. So I suppose it's seeing that system. And as part of cognitive behavioural therapy, we use, I often use an acceptance and commitment therapy as a framework, which essentially is to think for clients to change their relationship with their thoughts. So I suppose in terms of pain, for instance, they would be thinking, well, changing their relationship with their pain. So it's not seeing the pain as a problem itself, but the responses to it. And so it's very values-driven approach. So what we're looking at is people connecting to those values and leading the fulfilling life they used to lead, and having pain alongside that. So pain's in the passenger seat, they're in the driving seat. That's what.
So you're looking to change the patient's or client's perception to pain.
Exactly.
And then their response to it.
Or exactly.
How they respond to it, right?
Well, exactly, because if a patient is trying to get rid of the pain and have put their life on hold while they're waiting to get better, that's the cycle that we're trying to avoid, because then we get that sense of isolation, a sense of difference, and not engaging in the things that they used to enjoy, rather than, okay, I've got some pain, but I'm still going to live the life that I want and enjoy. And that then they get all the benefits in terms of mood, in terms of positive interactions, sense of achievement. All of these things are really key to people's self-esteem and confidence.
So cognitive behavioral therapy is CBT it's normally referred to as CBT,
yeah.
And ACT is
acceptance and commitment therapy.
So they're sort of connected to each other, are they?
That's right. So, yeah, ACT is defined as a new wave therapy within the CBT context.
Yeah. So it's the same sort of.
It's all around your relationship with your thoughts and your emotions. Okay. Yeah.
And that's done sort of face to face, or
Well, I suppose things have changed over the last 2 years. I deliver both face-to-face and online. And what I've realized is how effective online therapy can be. And people respond very well, it's very accessible. And in terms of that, the warmth in the relationship, in terms of the empathy, in terms of encouraging people to be compassionate to themselves and kind, we can do that face-to-face or online. But that's the key aspect. So the therapeutic alliance, I suppose, is strong there as well.
So the therapeutic effect hasn't changed, or the
No.
alliance, as a result of COVID, keeping people indoors and you
Absolutely
having
not.
to sort of see people over the screen rather
Yes.
than face to face.
It's
right?
worked really well, well. And I suppose because CBT is takes a very scientific approach, we've got lots of evidence of change. So we use psychometrics, we use measures essentially as to track people's progress from start to finish. So yeah, we've got lots of evidence of the effectiveness of the therapy.
Yep. So for someone who is in chronic pain and maybe is struggling, with their sort of thoughts or sort of low mood,
Yeah.
how would they go from where they are now
Yes.
to maybe taking that first step to
Yeah.
sort of getting help? 'Cause
Yes.
there's a lot of information out there and it's hard to know where to start, and sometimes
Absolutely.
I'm guessing it could be overwhelming to
Yeah.
patients.
Well, I
sometimes.
suppose the GP is always a good start point. So it's recognizing that your mood has been altered in terms of your relationship with your pain, or the fact that you feel different, and then that would start the process. Obviously, they can contact the London Back Pain Clinic direct, and we can start the process from there as well. Absolutely.
So, what are the type of things that people should look out for? Because I'm guessing it's hard to know, from a day-to-day perspective, if someone is struggling or not.
Yeah, I suppose. Well, it depends. I suppose in terms of low mood, you might think about your someone's concentration or their sleep cycles, or I suppose more hopeless thoughts about the future. Obviously, any thoughts about harming themselves. And in terms of anxiety, yes, we're thinking about worry increasing, feeling a sense of dread, I suppose, about the future, and feeling like, again, the things are looking more hopeless.
I guess what I'm trying to ask, though, is we all get thoughts of we all get anxious.
Yeah.
We all have sort of periods in time where we feel
Yeah.
sad or nervous,
Yes.
or we sort of have lack of sleep. But I'm guessing, at what point does someone go from it being sort of a temporary thing to a sort of problem,
chronic.
right?
Yeah, no, it's a good point. I mean, to normalize anxiety and low mood is helpful, I think. But yeah, if it becomes more sustained and over a period, and again, going back to that cycle, more isolation, I suppose, more worry, more withdrawal from the things that people enjoy in terms of the fulfilling life, then yeah. But people can, seek therapy at any time. I mean, they don't have to wait till it's become a chronic cycle. If you're recognizing that you're doing things differently, or withdrawing, or trying to, I suppose, protect yourself in a certain way, then you might want to seek some therapy. Yeah.
So when someone identifies that, what are the sort of steps, or what should someone do once they've identified that?
Yeah, well, like I said, we've got the GP is obviously a port of call, but they can contact the back pain clinic in relation to their pain, and having some interventions which are helpful, and just having that I suppose, the opportunity to talk about their relationship, and just, but what tends to happen is, when we're gaining an understanding, we can see links to things that may have happened previously as well.
So I guess to end, should we just say there is a path for someone out there if they're feeling
Absolutely. There's loads of services out there, and people shouldn't feel alone. They should always seek help.
Perfect.
Yeah.
Thanks very much. All right, guys, I'm Roy. Thank you so much for watching, and thank you to Sean for being here on our podcast today.
Pleasure.